Complications of the massive transfusions. So firstly we need to know what is massive transfusion. Massive transfusion is defined as a replacement of the transfusion. So there is replacement of transfusion. So transfusion of what? Transfusion of basically the 10 units. Transfusion of the 10 units, and what is it about? It is about the PRBC. And the PRBC in 24 hours or more than 4 units of PRBC, and this is in nothing but in 1 hour. Now we are going to look at the complications. In terms of the complications, the first one is the hypothermia. In terms of hypothermia, the mechanism is nothing but the blood products. If you see, the blood products are normally stored between 1 degree Celsius to the 6 degrees Celsius. That is the reason. Then looking at the coagulopathy. In terms of coagulopathy, there is the MT. MT is along with the PRBC, and this alone it causes a dilution coagulopathy, and this is against a consumptive coagulopathy, and this is caused by massive hemorrhage. Other thing to note is that it can be prevented by starting early transfusion. So prevention is by starting the early transfusion as well as transfusion of the FFP, the platelets, as well as the PRBC. So this is done in the ratio 1:1:1. Now the next complication, it could be due to the acidosis or the alkalosis. In the acidosis or alkalosis, they can be mild. It results in the increased CO2 levels, and it is in the stored blood by 21 to 35 days. And next we are looking at the metabolic alkalosis. In terms of the metabolic alkalosis, the citrate, if you see, the citrate, it gets metabolized, and it is metabolized to the bicarbonate. Next we are looking at the metabolic acidosis. In terms of metabolic acidosis, this is nothing but it is due to the tissue hypoperfusion.